Getting wise about your health. For women in rural communities, access to health care isn't always easy, but the Charleston County Library is helping to make visiting with a doctor a simple and stress-free experience. Devin Andrews is Associate Director for Community Engagement for the Charleston County Public Library System. It's good to see you, Devin.
It's great to see you too.
So tell me more about, I say WISE, but that stands for something much bigger. Can you explain what that does stand for?
Absolutely. That stands for Women in the Southeast, and it's our telehealth network that we've been able to form thanks to a partnership between Charleston County Public Library, MUSC, DHEC, and the College of Charleston, aimed at reaching women in rural communities to improve health outcomes.
I think people are wondering why the library system is involved, and we'll get to that in just a minute. But can we talk a little bit about telehealth in general and just getting access to health care in our rural communities? For people who live in cities or densely populated areas, you think, well, goodness, it's easy enough for me to make an appointment and go see a doctor. But in rural areas, it's a whole different ballgame.
Absolutely. Even in the best of times, there are barriers that keep women in these rural areas of the county from being able to access high quality health care. But even now, as the pandemic has affected us even more, to where women disproportionately have had to drop out of the workforce and have childcare needs that didn't exist pre-pandemic, we're just there to help connect them with high quality health care that they need to thrive.
Mm-hmm. And you're focusing on women's health in particular. Can we talk about why?
That's right. It's just allowing women to have pregnancy and reproductive health care surrounding postpartum needs, or it just really focused on meeting the needs of women at this time.
Mm-hmm. And telehealth, people think telehealth, well, it kind of speaks for itself. You talk to a doctor on the phone, which I think is what a lot of people imagine is what it is, but maybe you can actually talk about what telehealth means.
Sure. They'll be actually using our computers to have, face-to-face virtual appointments with MUSC physicians, and our CCPL's community health worker will be there to facilitate those, to get everyone set up on the computer so that they can have these private, high-quality healthcare sessions.
Okay, so this is actually to have a face-to-face over a computer. So where does the public library come into play?
Right. We are a natural fit. We've got 18 branches spread out all over Charleston County, including ones in very rural areas of the county. We've also got a mobile library that's basically a small library on wheels that has computers on board as well, so we can go to places that even don't have a physical library branch. So we can go wherever the need is in rural parts of Charleston County to connect women with this service.
What are some of the rural parts of Charleston County that we're talking about?
We'll be using our branches in Edisto, McClellanville, and our new St. Paul's Hollywood branch. So we'll be at those 3 physical library branches, but thanks to our mobile library, we'll be in Adams Run, Awanda, and Wadmalaw as well.
Okay, how do people find out when that mobile unit comes around to their area?
Yes, you can find more information on ccpl.org/telehealth. It'll have our schedule for every week, and information about booking appointments too.
Okay, and this is an also partnership not just with the library, but with the College of Charleston and MUSC. So this is all an effort to get MUSC doctors in front of patients.
Absolutely. So we're very excited about this partnership. We know that there's a need there, and we're hoping that through this joint forces that we'll be able to meet those needs.
If anyone's visited a library recently, you do have computers set up, but if this is considering someone's health, I would imagine that's a private conversation that you want to have in a private area of the hospital. So how do you manage that? Where are these appointments being held?
Absolutely. We've got private spaces. They're always going to be private. We've got a private meeting room that we're using at the St. Paul's Hollywood Library. And then at the McClellanville and Edisto libraries, when we're indoors, when we're inside the physical branch, it'll be totally closed off and private. Just the person and the MUSC physician on the other side of the screen. And then our mobile library, same thing. It'll be one person at a time, so that people know that they have private meetings with their doctor.
And if anybody needs a follow-up appointment, say something that ends up needing to be done in person, how does that get arranged?
Absolutely. Then they can refer the person to a follow-up appointment to where they need to go, call in a prescription to the pharmacy. They would take care of next steps to meeting that next healthcare need.
Perfect. And just finally, if you can remind everyone, how do they find out when the mobile unit's going to be in their neck of the woods, and how do they find their local public library?
Yes, you can find all of our branches at ccpl.org/branches and information about the telehealth at ccpl.org/telehealth.
Perfect. Devin, thank you so much.
Thank you.
We're back after this.